One common question I get regarding shoulder injuries is, but I don't remember an injury to my shoulder. How come there is so much damage, or how come there's a tear? The answer to that question is that most people don't remember an injury or a specific trauma. What we would call an acute tear of the rotator cuff that we can associate to a direct injury or trauma accounts for approximately 10 to 15% of all shoulder rotator cuff injuries. The vast majority are wear and tear over time, which will rarely present with my symptoms began on this date at this time. Most people notice slow onset of symptoms, worsening pain and weakness that slowly gets worse over time. Another question or comment that I hear quite frequently is regarding shoulder replacement surgery. A lot of patients are more familiar with knee and hip replacement surgery and aren't as familiar with shoulder replacement surgery. The reasons that we do the shoulder replacement are quite similar to the reasons that we do them for hip and knees. Typically, degenerative change in the joint, wear and tear of the cartilage, which causes painful motion. The type of procedure itself functions quite similar to knee and hip replacements as well. The idea being that if we resurface the joint with metal and plastic, that the motion is less painful as we removed those raw bony edges that were rubbing against one another. The important takeaway about shoulder replacement surgery as a whole is that it's quite successful, it works very well, and can be an extremely effective treatment for taking care of chronic shoulder pain related to arthritis. Thanks for tuning into this month's series discussing various shoulder injuries and treatment options. If you or anyone you know has any difficulty with their shoulder and would like someone to take a look, we'd be happy to see them, come up with a treatment plan, and help get you back to the things that you like to do.